All right. With Dr. Cohn's permission, I will go ahead and begin the public comment section of our meeting. I'd like to state that at the onset, I want to welcome and thank our public comment speakers for addressing the ACIP voting members today and the committee in general. All speakers today submitted a request in advance of the meeting, and the final list of public commenters was determined by lottery. I wish to make it clear to the speakers that we have a limited period of time for the public comment, and in order to make it through all of the speakers, it is extremely important that each speaker limit his or her comments to 3 minutes. You will see a green sphere on your computer screens that will tell you the time as you cycle through it. As you approach and reach your time limit, I will thank you with the following statement. Thank you for your comment. Your time has expired. If you exceed your time limit by 15 seconds, I will state as a courtesy to others, we ask that you conclude your comment. And if you exceed by 30 seconds, your comment, I will state your comment time is ended. Thank you, and your microphone will be cut. So again, I want to thank the speakers. I want to let you all know that your comments are extremely important to the members of the ACIP, and we look forward to hearing them. So with that, we'll move on to our first speaker, and it is Ms. Wang from the Hepatitis B Foundation. Ms. Wang, please.
Ms. Wang, we can't hear you. Can you unmute, please? We see you on the line. We still can't hear you. Dr. Romero, do you want to go to the next speaker and we'll swing back around?
Yes, let's do so. So our next speaker is Dr. Hazra from Harvard Medical School. Dr. Hazra, please.
Thank you. My name is Aditi Hazra. I'm a genomic epidemiologist and assistant professor at Harvard Medical School with expertise in RNA research, community engagement, and volunteer work with the Center for COVID Innovation. Thank you, Dr. Romero and Dr. Oliver and the ACIP for the opportunity to share my comment on equity and leaving no one behind. In my op-ed titled "Refugees are Essential to the COVID-19 Response," I described that 15% of refugees in the US work in the healthcare sector. These refugees need to be included in the COVID-19 vaccine phase 1 distribution strategy. To leave no one behind, I suggest that you consider these 4 E's. 1, equity and including refugees. 2, empowering communities with trust and transparent communication. 3, extreme weather preparedness. And 4, enrichment of trained vaccine providers. Next, I'll go through these 4 E's to leave no one behind in greater detail. First, equity. Evidence shows that immigrants, including refugees, are overrepresented in the healthcare personnel, but they have less access for their own healthcare. Healthcare workers with patient-facing roles, whether they are a refugee or a citizen, should be included in phase 1A. Second, refugees and migrant essential workers in the food industry suffered a disproportionate burden of incident COVID-19, and this subgroup should be included in phase 1B. Number 2, to empower communities, both urban and rural, with transparent and trust communications on vaccine products coupled with public health strategies such as masking and physical distancing is essential. Evidence shows that synergy and messaging with local leaders will enhance equitable uptake. Third, extreme weather preparedness with backup generators and additional sources of dry ice will enable equitable distribution to vulnerable communities devastated by weather-related events such as hurricanes in the Gulf Coast and wildfires in the Northwest Coast. Fourth, Enrichment of trained vaccine providers. Since the healthcare system is overwhelmed by the current surge, we need additional nurses, community healthcare workers with instructions on how to assess quality of the mRNA upon arrival, how to thaw, dilute the different vaccine products to ensure equitable shots in the arm across the country. In summary, the 4 E's that I've presented are equity and inclusion of refugees, 2, empowering communities with communication, 3, extreme weather preparedness, and 4, enrichment of trained providers. Thank you for listening, and thank you for leaving no one behind.
Thank you very, very much for your comment. Let's go back to Ms. Wang from the Hepatitis B Foundation, if she's available.
Yes, I am. Thank you.
Thank you.
My name is Evangeline Wang, and I'm the Public Health Outreach Coordinator at the Hepatitis B Foundation. We appreciate the opportunity to speak at today's meeting. Amidst the COVID-19 crisis, low adult vaccination rates, and the opioid epidemic, the hepatitis B community is deeply concerned about current guidelines' ability to protect vulnerable communities from the new Hep B infections. We urge ACIP to consider recommendation for universal hepatitis B vaccination to help protect susceptible populations. In the spring of 2020, the American Journal of Managed Care, the American Medical Association, and the Association of the American Medical Colleges, and several other expert institutions noted that the pandemic is exacerbating the opioid crisis. This comes at a time when current public health emergency is hindering standard public health programs like viral hepatitis prevention. Recent data suggests that community-based organizations saw their hepatitis vaccination efforts reduced by 42%. 52% of these community-based organizations surveyed have furloughed or laid off staff or reduced the size of their standard operations. With these changes, some of which might be permanent, and the steady rise of acute Hep B infections, we must take action now to increase adult immunization rates. The ACIP recommendations are influential in national and state planning for hepatitis-related goals. The CDC's Division of Viral Hepatitis uses the recommendations of ACIP to develop long-term strategies, including their most recent 5-year plan. The National Viral Hepatitis Progress Report, another key planning document for states and organizations, aligns how they track and measure progress based upon the CDC reports. Therefore, ACIP's recommendations have far-reaching consequences that go beyond identifying who should be vaccinated. The recommendations can determine where organizations focus their outreach efforts, where funding is allocated, and what actions need to be taken to improve vaccination rates. While high-risk groups are essential to prioritize, we cannot meet national hepatitis elimination goals without incremental changes. A recommendation for universal adult Hep B vaccination would capture emerging at-risk groups and allow organizations to use resources to support more innovative strategies to vaccinate the broader adult population, of which just 25% are fully vaccinated. It's also important to note within the National Viral Hepatitis Strategic Plan for 2020 through 2025, the Division of Viral Hepatitis acknowledged that the updates were needed to the ACIP's adult Hep B vaccination recommendation. The inclusion of this strategy as a way to increase adult Hep B vaccination coverage confirms that the current recommendations are hindering progress towards elimination of hepatitis in the United States. In conclusion, hepatitis B is a serious virus with potentially devastating consequences. We have a solution, but the support of ACIP is integral. Thank you for your time.
Thank you very much for your comments. Our next speaker is Mr. Mattison from the National School Transportation Association. Mr. Mattison. Mr. Mattison, are you there? You can go forward.
Good afternoon. My name is Kurt Mattison, and I am Executive Director of the National School Transportation Association. NSTA appreciates the opportunity to make comments in support of school bus drivers being classified as a high priority in the ACIP recommendation for phased allocation of COVID-19 vaccines. NSTA represents private school bus companies who provide pupil transportation services under contract. Keep in mind that student transportation is the largest transit sector in the United States. Nearly 500,000 school buses transport close to 26 million school children daily to and from school. That's more passengers than transit, bus, rail, and aviation combined. Since we are a hybrid within the educational and transportation sectors, we want to ensure that school bus drivers are specifically addressed in your phased schedule. Needless to say, the last 9 months have been challenging environment for us, and we look forward to a complete return to the classroom for all students. But even with schools being closed, NSTA member companies have stepped up to deliver school nutrition meals, transported school supplies, and even provided Wi-Fi access to students. The most important element in achieving a complete return to the classroom will be to ensure an adequate number of skilled, trained, experienced, and licensed school bus drivers. But providing equity in access to in-school learning cannot simply be based on rhetoric and good wishes. NSTA estimates that 5 to 10% of industry bus drivers are currently sidelined by COVID-19, and those numbers continue to rise. These drivers who are infected, exposed and quarantined, and those are on leaves of absences. NSTA also estimates that approximately 33% of industry drivers are age 60 and older, and we are a racially and ethnically diverse group as well. To summarize, many school bus drivers remain fearful about a return to work without a vaccine, and targeting this group will certainly assist in the prevention of transmissions as well. School bus drivers are included on the Cybersecurity and Infrastructure Security Agency list of essential critical infrastructure workers. They are listed in both the education and transportation sections of the latest version from 2020, and that was in August of 2020. Inclusion of school bus drivers on this list that CISA validates that drivers are essential, and we believe this distinction is probative for the ACIP to consider as well. Without a healthy and plentiful workforce of drivers, more children may be forced into less safer ways to get to school, and many may not have access to pursue their educational opportunities. Given the advisory committee's membership of physicians involved in public health, we share some data points regarding the industry's safety and environmental record. According to DOT statistics, the school bus is the safest form of transportation for students, and we provide safety statistics in our written comments. In addition, one school bus takes 36 passenger vehicles off the road. We appreciate the work of the advisory committee, and we thank you for the consideration of our request.
Thank you for your comments. Thank you. Our final speaker today will be Ms. Peschen from the Alliance for Aging Research. Ms. Peschen.
Thank you. Good afternoon. I'm Sue Peschen, President and CEO at the Alliance for Aging Research. The Alliance supports the National Academy's framework, and we ask ACIP, as you do your important work, to please keep the following in mind. First, it's critically important to ensure that nursing home and home health care staff are vaccinated in the first phase, given the high-risk nature of their care population and the rate of transmission in congregate settings. Additionally, in communities where hospital capacity has become constrained due to current infection rates, home health staff are filling the gap to support older adult COVID-19 patients in the home. Next, we support the vaccination of older adults in congregate settings, given the patient acuity and proximity of the resident population. COVID-19 cases in long-term care facilities account for 7% of infections, but 40% of deaths. Vaccinating this population can also help speed the ability of facilities to restore visitation by family caregivers. In phase 1A, we recommend the inclusion of long-term care pharmacists as frontline health providers. Pharmacists in these settings maintain medication access and support continuous adherence to therapeutic regimens for older adults in congregate settings. The Alliance also supports access for all other older adults in Tier 2. Adults 65 and older account for 16% of the U.S. population, and right now, 80% of all COVID deaths. Even if an older individual doesn't have a high-risk condition, immunosenescence contributes to higher vulnerability. We very much support the National Academy's prioritization of equity as a cross-cutting consideration. The framework notes that in each population group, vaccine access should be prioritized for geographic areas identified through CDC's Social Vulnerability Index or another more specific index. Of course, none of this is going to be successful without adequate resources for distribution, tracking, and monitoring to implement plans to vaccinate all Americans. Infrastructure investments must go towards strengthening, enhancing, and expanding the ability of public health officials and providers, including pharmacists, practicing at the top of their license in the community to meet demand for a future COVID-19 vaccine and also reach populations who are currently under-vaccinated. The Adult Vaccine Access Coalition calls for at least $8.4 billion in funding to be directed to support this effort. AVAC also calls for utilizing existing infrastructure, such as immunization information systems, to track vaccine doses, as opposed to rushing to create new and untested systems. We also need to identify the biggest draw locations for different groups to get vaccinated: pharmacies, grocery stores, drive-through events, churches, or other places we have yet to think of. The Alliance is doing survey work on this that we'll share very soon. And last, Dr. Redfield, Dr. Messonnier, to paraphrase from Dr. Redfield's opening comments, thanks to you and your agency colleagues for staying in the arena and listening to the community. We need you now more than ever. Thank you.
Thank you for your comments. Our final speaker, forgive me, will be Ms. Shafi from the National Consumers League. Please go forward, Ms. Shafi.
Thank you so much, Dr. Romero. Good afternoon. My name is Nisa Shafi, and I'm here today on behalf of the National Consumers League. For over 120 years, NCL has advocated on behalf of consumers who depend on vaccines as life-saving medical interventions. We appreciate the opportunity to speak on behalf of consumers today, and we extend our gratitude to the Advisory Committee on Immunization Practices for its role in protecting public health. Upon release of an FDA-approved COVID-19 vaccine, post-market surveillance will be imperative to determining its ongoing safety and efficacy. As the nationwide distribution efforts commence, consumers will rely on public health agencies to communicate and respond to any potential adverse events regarding the vaccine. Additionally, a fortified immunization information systems infrastructure will be integral in adequately marshaling vaccine resources. These measures will provide public health officials and providers with the necessary information to effectively administer and monitor vaccine activity. Considering the efficacy of multiple vaccine delivery methods, including an oral or nasal form, could provide Americans a vaccine where they live and meet a variety of diverse health needs. Ensuring innovative vaccine delivery methods has the potential to increase vaccine compliance and enhance overall uptake that could thwart the spread of the virus. As the polarization of public opinion continues, we must ensure that anti-vaccine sentiments do not foil critical public health interventions. We encourage ACIP to maintain effective public health messaging and clear vaccine recommendations to ensure that the American public feels safe and empowered in their decisions to vaccinate once the vaccine becomes available. Additionally, the pandemic has further illustrated inequities experienced by chronically underserved communities most vulnerable to health disparities, specifically Hispanic or Latinx, Black, and American Indian and Alaska Native communities have experienced vastly disproportionate rates of infection. An initial limited supply of a vaccine will only intensify these inequities. As such, we implore the CDC to designate Tier 1 priority for populations at the highest risk of contracting the virus with regard to equitable allocation of the vaccine. Considering the efficacy of multiple delivery methods, finally, NCL requests that clinical trials for the COVID-19 vaccine are inclusive and reflect diverse subjects. People of color are significantly underrepresented in clinical trials and undertreated in medical settings. Ensuring adequate representation in clinical trials would foster vaccine confidence across all demographics. In closing, to stem the tide of vaccine-preventable diseases, NCL submits these comments for review by the committee to ensure that consumers are afforded with safe and effective vaccines to combat the pandemic. Thank you so much for your consideration of our views.
Thank you very much for your comments. That ends our public comments section. I will see if Dr. Messonnier or Dr. Cohen have any additional comments.
Thanks, Dr. Romero, and thank you to all of the members of the public who spoke today. I also want to remind our ACIP members, as well as all of the people listening in, that they can review the written public comment. And if you go to the ACIP website, there's information on how to access that site. I also want to let everybody know before we dismiss that at this time, we do not have a date for the next ACIP emergency meeting. We are working on that, and we will communicate that in the near future. But ACIP will not plan on meeting until after the VRPAC meeting on December 10th.
Thank you very much, Dr. Messonnier, anything else?
No, I think given that it's already 5 o'clock, I will just say thank you and point out that, it's going to be a really busy month, but I do hope that everyone has a chance to sit around the table and give thanks for their families and their friends. And I certainly, I'm certainly going to take a moment out of my day to do that and then get back to it. It's going to be a busy month, but at the end of it, there's a great reward. And I know we are all looking forward to the availability of these first vaccines. Thank you.
Thank you. So we have a lot still to be thankful for, even though we're in the middle of a pandemic. Among those things is the fact that we have assembled an incredible group of persons and experts on this committee, the liaisons and the ex officios, who are offering their insights and their expertise in trying to develop prioritization schemes for these coming vaccines. So I wish you all a happy Thanksgiving and enjoy the company of your nuclear family during these days. We will see you in the near future. Goodbye, everyone. Closed meeting.